new Omicron variant of COVID-19 is now forecast to become the primary source of COVID-19 infections in the U.S. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and infectious disease specialist at Tufts Medical Center. Welcome.
Nice to see you.
All right, Dr. Boucher, let's take a look at this new data from the CDC. So for the week that ended December 4th, Omicron accounted for 0.1% of all sequenced COVID-19 cases in the U.S. Well, fast forward 1 week later, that number has risen to almost 3%. I think most experts might agree this, though, is just the beginning. That's a pretty extreme rise in the span of 7 days.
That's right, Ben, and I think we have to keep our eyes on the data as time goes by to see if the Omicron will replace the Delta as the circulating variant of this virus. I think it's also important to stress that the pain that we're feeling right now is from Delta, and there's still a lot of things we can do about that, and it's important to focus on that today.
All right, well, it's that time of year. We're quickly approaching Christmas and New Year's. Do you think people who haven't received a booster shot yet need to avoid indoor gatherings or even consider changing travel plans?
Well, I think everybody needs to consider the risks that they're willing to take. And we know that being fully vaccinated and gathering with other vaccinated individuals is safer, and that those who are eligible should get that booster because that will further protect you from getting sick enough to be in the hospital or worse, and protect you from Omicron. So decisions about gathering with others, I think thinking about extra layers of protection, masking when you don't know the vaccination status of others, considering a test just before a gathering as another layer of protection. These are things you can do to reduce the risk of that gathering. I think travel is another decision that needs to be made carefully. And if you do travel, I strongly recommend masking and following those other mitigation measures in addition to being vaccinated to lower your risk.
All right, Dr. Boucher, as you're well aware, Boston hospitals like Tufts are already dealing with a surge of patients from Delta, as you point out. So could a takeover by Omicron make the hospitalization situation worse?
You know, it could, Ben. The Delta situation could get worse, and I think it's extra important that we focus on the things we know work. I do want to stress that we are in a better place today than we were a year ago, the day of the first vaccination, right? We know that vaccines work and keep people out of the hospital or worse. So getting that vaccine if you had it, getting a booster, very important. Thinking about masking up when you're around individuals who are not vaccinated definitely works. Thinking about other measures like testing, also important. Don't come to work or school when you're sick. These are things that will help keep us safe and keep our hospitals able to care for the patients who need us, those without COVID as much as those with COVID.
All right, and Dr. Boucher, we have viewers watching right now who may have surgery scheduled or routine treatments for chronic health conditions. Others may be pregnant women waiting for their delivery date. What advice do you have for them? Should they talk with their doctor about some sort of backup plan?
Well, it's really important to go to your appointments, right? If you have an appointment with your doctor for your chronic condition, keep that appointment. If you're pregnant and having a baby, that's an emergency. You're going to have that baby. If you have what we call an elective procedure, something that might be put off, that's a good thing to call and talk to your doctor about because it might be necessary to put that off a few weeks as we're in the middle of this surge.
All right, Dr. Helen Boucher at Tufts Medical Center, thank you so much for your time.
Thank you.